End of the campaign to sensitize mothers on the importance of breastfeeding, with a section of women counting their blessings, especially with the COVID-19 pandemic. Our health reporter Zainab Mohammed interacted with the lactating mothers, and as she reports, majority have termed the COVID-19 pandemic as a blessing in disguise.
2 p.m. at the Ngondis, and it is business as usual for Lynette Kamau. She is in the midst of a Zoom work call. In her hands is her 8-month-old baby.
Yeah, it's just that, we need to fine-tune it a bit. In practicality, like if we're thinking about...
Lynette is a communications expert with an international non-profit organization here in the country. Being a Tuesday, it is a busy working day for the first-time mother. The pandemic has forced many organizations to adopt the working from home formula for non-essential workers, and Lynette's employer is no different.
If he needs to feed, I feed him, and then I go back to work. Like that. So there are times I've had meetings and I'm breastfeeding, so long as the video is not on. And there are times, that's how it's been, and I think I've appreciated that. We've bonded more. He's been properly nourished, at least from what I've gotten as feedback from the hospital, and I haven't had to feel that pressure of, gosh, I don't have enough milk.
Juggling between work and the baby, Lynette tells me her days are no walk in the park.
So there are days I'll wake up as early as 5:30 or 6 and work, because I know by the time the baby is waking up, I need to maybe feed him or I need to attend to him somehow before I hand him over to the nanny. And at times it means, if he's like the other day he had a cold, waking up that early is not ideal because we just generally didn't sleep well. So it means I'll wake up later, which means to some extent I will have to figure out how to cover the time.
Even though Lynette's workplace has a proper lactation room set aside for nursing mothers, she reckons it would not be the same as raising her baby herself. At the Moriasis, the situation is no different, and Songole, a mother of 3, is also in the midst of a busy working day. A few meters from her are her playful babies. The 36-year-old communications expert is an experienced mother who has seen the best of both worlds, having raised babies pre- and post-COVID-19.
Now that I'm at home, I had given up hope of even continuing to nurse him, but because with the rest, I couldn't continue nursing them, as long as I wanted, because I had to go back to work. But with him, I've managed. I'm still nursing him. He's a year and 4 months. Is it 4 months? And I'm still nursing.
Anne says she has set strict schedules for her and her nanny, allowing her to focus on work during the day and the babies at night. But this, she says, is a delicate balance.
At work, you'll take breaks, you'll do that normal coffee break. You'll go talk to your colleague. Your colleague is right next to you, probably, like where I work. So we're always chatting, and so I'll lose some time there when I'm at work. But when I'm at home, I don't have that opportunity to kind of debrief, to laugh, to kind of socialize with colleagues. So, when you don't have that, then it means you're working.
Anne only began working from home a few months ago, despite the country and the globe in general experiencing a pandemic. She, however, couldn't be more thankful for the arrangement.
For me, who's also breastfeeding, it's been such a blessing because I've been able to nurse this child. I can tell you, I've been there for all his milestones. And I feel like even the fact that I'm able to breastfeed, he doesn't get sick easily. He doesn't get these infections.
With various social, psychological, emotional and environmental factors affecting optimal breastfeeding in Kenya, poor social and professional support is one of the major factors affecting working mothers. Data from the Kenya Demographic Health Survey shows only 61% of children in the country receive the required 6 months exclusive breastfeeding. 15% receive breast milk plus complementary foods. 1% are completely not breastfed, whilst the remaining receive breast milk plus water plus other complementary milk products. Further studies show out of a 62% women workforce in the country, 52% are forced to return to work 3 months after birth, with the rising challenges such as reduction in frequency of meals, insufficient milk supply, and long working hours, leading to the adoption of complementary options before the required 6 months. This results to malnutrition in children under the age of 5, with 5 in every 10 children in the country dying due to malnutrition, contributing to 45% of deaths in children under the age of 5. Further, poor breastfeeding and complementary breastfeeding practices have been shown to contribute to 19% of these deaths. Kenya has not ratified the ILO Convention 183 of 2000 on maternity protection. However, parts of the ILO Convention have been adopted in a number of policies, including the Kenyan Employment Act of 2007, the new 2010 Constitution of Kenya, the Collective Bargaining Agreement of 2010, and the Kenya National Health Law of 2015. The now open to the public Sabina Chege-sponsored breastfeeding bill, seeking to amend the Kenya Health Act of 2017 by further proposing for baby changing facilities for use by the public.
What we are saying, a place where at least offices, where there's offices, every office or every building, public building, to set aside a room with just the basics, comfortable seats, a place where the women can even change diapers or even nappies. Even in the marketplaces, it's sad that in this town we have smokers zone. We have a room where smokers go in and smoke. But in this Nairobi, and it's a very big city, if a woman travels with a child from home to come to the city, maybe you want government services, where can you change your baby? So we are saying all government facilities, even the government offices, to actually have a place secluded, clearly labeled, that is a breastfeeding area.
Hapa bungeni kwa wakati wa nyuma kulikuwa hakuna chumba maalum ambacho ni cha wabunge kina mama ambao pengine wangetaka kunyonyesha watoto wao, lakini hivi sasa kimeweza kutengezwa. Na pia hivi karibuni tumeona sehemu nyingi sana, mashirika mengi sana yameweza kulaunch ama kutengeza sehemu haswa makususi ya kuwa kina mama wataweza kunyonyesha watoto. Na huu mswada tulionao sasa, wakati tutamaliza kufanya debating na uende uwekwe saini na Mheshimiwa Rais, basi utakuwa umebeba yale matakwa yote ama kulinda kina mama ambao wanaweza kunyonyesha.
Should the president sign the bill into law, organizations with more than 30 employees will now be required to not only have a breastfeeding room, but a changing facility for babies as well, even as the working from home formula proves to be an equal platform for nursing mothers to compete with their male counterparts. Zainab Mohammed, TV47, Nairobi.
Thank you.